Did you know that there's a quick and painless test that could identify if you're at risk for coronary artery disease? It's called a heart scan calcium test, and it could save your life. To talk more about this important test and steps you should take for a healthy heart, with us today is Dr. Gayatri Acharya, Cone Health Heart and Vascular Medical Director of Cardiac Imaging. All right, most of people have never even heard of this, and when you think of calcium, we think of the milk that we drink and our bone health. So let's talk about how this is related to heart health.
Right. So the calcium we see in the heart arteries is different than the calcium that keeps your bones strong, which is really important to have as well. The calcium we see in the heart arteries is actually soft, squishy plaque that has aged over time, that cholesterol plaque that has gotten kind of old. It may have been there for years, and we're able to detect it with this scan, so we can figure out if you've got plaque in your arteries.
All right, so let's talk about the scan, because whenever we think about somebody looking at stuff in our hearts, we're thinking it's got to be invasive. So if someone has calcium or plaque buildup in their arteries, would they even feel it? Would they have symptoms?
So very often people will have no symptoms. And as I mentioned, this calcium, this old plaque that's sort of turned to stone, can be there for years, and you really may not know it. Now, certainly some patients can have chest pain or shortness of breath, and that may be their first sign they've got blockages, but very often we don't. And so the goal of this scan is to detect it before you have symptoms.
Okay, and is this scan, the only way to detect it?
This is, it's one of the things we use for risk stratification. So certainly we can get an inkling that somebody may have blockages if you've got diabetes that's not well controlled, kind of very high blood pressure, not on medication, cholesterol that's not well controlled, and you can discuss with your doctor what the really adequate numbers are for you. We add this to this kind of assessment we do for the patients. This is probably the simplest way to figure out if you've got blockages, and painless, as we've sort of alluded to already.
Yes, we like the fact that it's painless for sure. All right, who is the heart scan calcium test recommended for?
So who I use this for is a patient who's not having any cardiovascular symptoms. So no chest pain, no shortness of breath, nothing I'm very worried about. This is really for the patient without symptoms. And I tend to use it for my patients who are at an intermediate risk for heart disease in the future. We use a 10-year risk scoring. And when you fall into this intermediate risk, meaning you might have diabetes, high blood pressure, cholesterol issues, I can use this test as sort of a tiebreaker. If you've got calcium, it pushes me to be a little bit more aggressive with your care and your medications. If you don't have calcium, maybe we can let you sort of push a little harder on your own with diet and lifestyle.
Okay, and is this in place of like a cholesterol screening, or is it in addition to something like that?
I use it in addition. I use it as additional data to really break the tie, and inform us on your risk over time.
Okay. All right. So this would be something that I don't know, would you wait until your annual physical to discuss with your doctor, or do you do this at another time?
So this test is offered year round, and you can speak to your primary care provider to have this ordered, or speak to your cardiologist to get this test ordered. But you can really do this at any time. It's offered through Cone Health at somewhat of a discounted rate. It's $99, and unfortunately insurance doesn't cover it yet. Hopefully they will one day. But at $99, it's really, is this something that you feel is important to understand your health better? If so, this may be the right test for you.
Okay, and so let's talk about, like, how long does the test take, and then how long does it take to get the results back?
So it's a very easy test. We don't have to put in an IV for IV contrast. We don't have to give you any medications before. The CT technician will lay you in the CAT scanner for about 60 seconds. You'll go through the tube quite quickly, and you'll have a scan. It'll be sent to the physician to read it. And after that, within a few days, your physician will have a chance to look over the results and formulate a plan for you. And within a matter of days, there should be a better sense of what your risk is going to be overall.
Okay, so just a few days, and then just like a couple of minutes for the test. All right, what happens if the test detects levels of that calcium higher than you'd like to see?
So really, we like to see a calcium score of 0. A calcium score of 0 doesn't necessarily mean you don't have any plaque, because we can't see the soft plaque with this. As I mentioned, we don't give you any IV contrast, so we can't really light up those arteries to look inside. But we use the scoring of the calcium. Literally, we'll sit there and kind of draw circles around how much calcium's in those arteries and formulate a score based on that, and then compare you to people of your same age and ethnicity to really see what your risk is compared to those just like you. It's again a very easy test to complete, and it shouldn't what you get for it in the end, I think, is well worth it.
Sure, because you might actually have a better idea of, okay, my health is better than what I thought it was, right? And if it's not, then there's other things that need to happen. All right, we're going to continue on with this conversation. We'll be back in just a minute. We're going to take a quick break.